Skin tags affect very many people, and although often harmless, they can present a cosmetic issue. They usually occur around the face and neck area, especially around the eyes. Today we'll be talking to a medical aesthetics specialist who will tell us more about the treatment for skin tags. Stay tuned as we learn more about this on the Skin Therapy Show. My name is Joy Muthengi. Welcome. Well, joining me on the show today is our lovely friend Domiana, who's been kind enough to welcome us back into her place of business. So Domiana, great to see you.
Thank you.
You look amazing. I love the green.
Thank
power
you.
suit.
Thank you. Thank you.
So the topic on the show today is skin tags. So exactly, I knew what they were. Once I saw a photo, but I didn't know they were called skin tags.
Yeah.
So how can someone identify that they have skin tags?
So I would say again, my name is Domiana. I'm a skin consultant or esthetician. So to know that someone has skin tags, it's a mass that is a bit more pigmented, and mostly they appear on the cheeks and on the neck. Yeah. So they will be a bit more darker than your normal color. Right. So it starts with the pigmentation, a spot pigmentation. Then in few months it grows to be a mass protruding from the skin, which is a little bit more darker than normal skin. Yeah. Yes, that's why now you will get to know that you have skin tags.
Yeah, and some people get them around the eyes as well.
Yeah. They come very close around the eyes, and they are quite big and darker. So, and they're flat. We have different types of skin tags. We have protruding one and flat ones. So it's just a mass which is more darker than your normal color. Okay. So we have different. We've said we have flat ones and protruding ones. So either can show that you have skin tags.
And what causes skin tags? Because I've seen them. I know people who have them. They don't seem very bothered by them. It's kind of just like, oh, it's a birthmark. But what actually is the cause?
Causes, first it starts with hormonal imbalance. It happens to men and women, but mostly women get them more because of hormonal imbalance, especially when someone had a pregnancy. They tend to get after pregnancy. That's when someone will notice, oh, when I got pregnant, that's when I started noticing skin tags. So they get more because of hormonal imbalance. A second, because of diet, and that one go more to sugar levels. Okay. Yes, mostly we get clients with diabetic, they have more skin tags because of their imbalance of insulin. So that will cause skin tags to be more, to grow. And also genetics, because of probably your parent had skin tags, but when you're young, they don't grow. You get them at 40, 30 because of age. Yeah. And also another thing that we're noticing a lot after interacting with our clients, we are finding that if someone has been stressed, someone would get skin tags. Their skin would change, to dry, and then it start growing. So also stress also plays a lot for someone to get skin tags.
Yeah. There's quite a number of factors that are involved here. Yeah. Are there skin types, because we've talked about skin types with you as well before, are there particular skin types that are more prone to skin tags?
We would say it's age skin.
So it's more age?
More age skin. So young skin, it will be very rare for a young age or a young skin, which is it's normal to get a skin tag. But someone, when they get age skin or dry skin, as they age, they get more skin tag and they grow more faster. When someone is a bit more older. Yeah. So unless someone, a young person has diabetes, that one would get them more because of the condition they have. Yeah.
Okay, so you said both men and women.
Both men and women, but mostly women, because they tend to get hormonal imbalance because of lifestyle. If someone gets pregnancy, probably if they are using family planning, also they will tend to get very bad hormonal imbalance. Then now that one will trigger the skin tag growth to be faster and more. Yeah. As compared to men they will get skin tag from the gene, genetic. If their parents had, then they will get, but then they will get a bit more older when they're at 40, 30, like that. Yeah. But not when they're pretty young. Yeah.
So a lot of people will see skin tags on themselves, or that they're growing, and say, let me take care of this myself at home. Yeah. And they'll be, tempted either to pluck at them or to cut them off, or and I know that can be quite dangerous.
Yes.
So is it at all advisable to take care of it yourself?
It's not advisable at all, because when you try to remove from home, probably you use something, you use a laser blade or a tweezer or just a sharp object, meaning you're going to open up your skin. And when you open up your skin, then you're prone to get infection. And you can bleed actually more. You can bleed, and then you can't control the bleeding from home.
Right.
So it is advisable also to go to a dermatologist, to go to aestheticians, or to go to a doctor. It will be more safer than to do it from home, because you can actually infect your skin more and then now get more other problems.
Yeah.
Or bleed more that you cannot control from home.
Yeah.
So we advise just go to a aestheticians or a dermatologist or to a doctor.
Yeah.
Or they will know exactly what to do. And again, we've said they had different types of skin tags. We have skin tags, and we have a skin tag caused by viral infection.
Oh, okay.
Yes.
Okay. Tell me more about that.
So viral in skin tags, or they're warts. No, they're not skin tags. They come because of genetics. Warts, we get them from a viral infection, HPV, which causes skin tag over the time. Someone will be infected with HPV,
Yeah.
but then after 10 years is when they tend to get the warts.
Wow.
But these specific ones, they grow more on genital area, and they're a bit more darker and thick, and they
Yeah.
grow bigger,
Yeah.
quite faster than genetic skin tags.
At which point do you say, okay, this thing has grown enough that I need to go see somebody about it, like it's a problem? Is it just like purely cosmetic where you don't like the way it looks, or is there somewhere where you're like, I need to go get checked?
Some of them, they grow bigger and they're uncomfortable, like the genital warts. They grow
I can
bigger, and
imagine.
someone feels, because of friction, it feels uncomfortable. Some of them grow and the underarms, which is also painful when someone tries to do waxing. Because I remember we had an experience where this client came, and he came to do just a waxing, normal waxing.
Right.
Until when we were doing it, that when we noticed he had skin tag around his underarm area. Then he kept saying this thing, they keep growing, and whenever I shave, I cut them. And then within 3 weeks or 4 weeks, I'm in pain because it leaves a small wound.
Yeah.
Then now we advise the client, now we need to remove the skin tags. Then now you come some other time, we do the waxing. Because when you keep doing waxing on a skin tag, then it cuts, then it leaves it unattended very well.
Yeah.
So we first diagnose which type of skin tag, then now we are able to know now which way to take. And then of course we also check on contraindications that will make us not do remove the skin tags.
Okay, and
so
that would be things like what?
things like if someone is diabetic again and it's not well balanced,
Yeah.
because when you're diabetic, then you get a wound, it takes forever to heal.
Yeah.
So we probably be careful on the way we remove it, or at some point we tell them we cannot do it now until you come with a doctor's letter for us to proceed.
Yeah.
Yes. Contraindication, another one is if you have a wound around that area, like you have an open wound on where the skin tag is, then we are not able to remove, because also we are avoiding to spread the infection.
Yeah.
Or if you have another skin condition like active acne on the area we are removing the skin tag, then we are not able to go on. Or else if you have eczema and it is very active at that particular time, it will be a contraindication. We'll first treat the eczema first, and then we proceed with the skin tag some other time when the acne is down.
Yeah.
Yes. And probably if someone has skin tags around the mouth and they have cold sores, and we can't do.
Yeah.
Yes. So we first check on contraindication, and if there's any underlying condition like epilepsy, because we use electric plasma pen to remove.
This is the septic pen.
No,
that's
that
something
is a
else.
caustic pen that you buy from the chemist.
Okay.
And then you use it from home.
Okay.
But we have a plasma pen, which
Okay.
is electric. Yes. So when we remove it and someone has epilepsy, can trigger yes, the condition, then now they start conversing.
Yeah.
So if someone has epilepsy, then it's also a contraindication. So we have a consultation card that we take our clients through,
Yeah.
and we get to know all the contraindications. Then afterwards, when we conclude then it's fine, then we go ahead to do the skin tag removal.
Yeah.
So we just don't come in
And
then we
just-
take you to the room. No,
Yeah.
we have to check through the contraindication, and if there's something that will hint us not
Any
to.
underlying
Yes,
condition.
yeah.
Yeah.
At some point, we'll also check on we'll analyze on the skin tag. If it is a bigger and it is more color, it's green in color and a pale, that one we can't touch.
Yeah.
We have to send them to a doctor to be analyzed if there is something much more than just a
Going on.
skin tag.
Yeah.
So we don't touch that one. We'll send you to a doctor to go be checked. If you come with a letter saying it's just a normal skin tag, then we can remove.
When we talk about treatments, you know, a lot of people are always looking for quick fixes. So is there like a cream? Is there anything like over the counter that you can be able to buy to take care of that?
There are some creams, but there's some creams, yes, but it takes forever for it to come down.
Yeah.
But the procedure that we use, it is instant, but then there is a healing process that takes after 4 days. We also give you a cream to moisturize where the skin tag we've removed.
Right.
Then the healing could be easy, and we show you how to do it from home. I mean, to take care of the area we have removed. So there are different ways. You can buy a caustic pen, which takes forever. For some of them, they are thick, that even if you use the caustic pencil, it will not remove
It
it.
needs that extra treatment.
So it needs that electric plasma pen that we freeze with it. We'll see later how we do it.
Right. Okay. Speaking of which, it's time for us to take a short break here on the Skin Therapy Show. But when we return, Bridget will be taking us through the treatment process for skin tags. Stay tuned. We have so much more coming right up. And welcome back to the Skin Therapy Show. Thank you so much to Bridget for taking us through that demonstration of the treatment process for skin tags. Now, do remember, it's very important for you to consult a professional, a dermatologist, or someone who can take you through this journey of treatment in a medical setting to ensure that you have the proper results. We're back with Domiana, who has been enlightening us on what we've come to understand as skin tags. And I didn't know much about this, so thank you for the information that you're providing me and the people watching at home. So we've watched one of the removal processes. How likely are skin tags, likely to grow back after a treatment like that?
They grow back. It's likely to grow back because we said we get them from their genetics, so there's no way we can remove them from the yes. So, but then after removal, then after we give you a cream that after healing, then we continue with also treatment. We also come back because you normally get a scarring. Yes, then you come back, we do another skin treatment, like a facial treatment, just to make the surface area to be smoother and like the rest of the skin. But because they're genetic, they will come back after 2 to 3 years. Yes, so we normally get our clients coming back after 2 to 3 years or 4 years. But recently we got this cream, it has glycolic, which keeps minimizing them not to come back. If it start coming, when you use this cream, we have it, we sell it, that it minimizes them coming back. So forever you will find that you won't get them back. But if you get them back, because there's that possibility, they grow very tiny. So we just come, we freeze one session, and then that's it.
Yeah. So about how many treatments would it take for someone just coming in initially with skin tags and they want the removal process?
So initially, there are people who have quite, I would say, the number or the area covered. Some of them, they come covered just around the eyes, right? Like there are 4 or 5. So that one will do like one session and then that's it. But some of our clients, they will come like the whole face, neck, and behind the neck. So that one we do like faces. Also we check on the career. Let's say you go to the office, you go to your meeting, we don't want to remove everything else, then now you're not able to go to work. So we divide the face, like we would remove around the cheeks and the eyes. That is one session. Then you come another after 2 weeks or 1 week, we remove another segment. So the healing also will take intervals such that you don't appear with so much scars. So also during consultation, we get to know your career, what you do. Then we divide. The much more you have, the more session we'll give you. But mostly when they come just around the eyes, we do only one session.
Okay.
Yes. Okay. But the others who come with some around the neck, underarms, so it takes like 4 to 5 depending.
Yeah.
Yes.
And so you're left with that scarring, but that's something that you also take care of.
Yes. After 2 to 3 weeks, 3 days or 4 days, now you get a scar. Like the way you get a burn, then you get a scar. Yeah. We also have treatments to take care of that scar until it gets even out to your skin tone color. So we continue, we don't just remove and leave you. We remove, give you a cream, then you come after 2 weeks, we take care of the scarring, then after 3 weeks, like that. So we give you like, let's say probably like 4 sessions of taking your skin like proper, like no one will tell you ever had skin tag. Yeah. Yes. And also another one thing I need to mention, we use this plasma pen and we use needles. Before you lie down to be removed, make sure they are having a needle for yourself. Because someone can use that one needle, it freezes, then it remains an inch or 2. Then someone will keep that for the next client. So you have to make sure they are using a new needle from the package for your treatment alone. Yeah. So you have to check, you just don't go lie and then now you're being removed. You need to check of the equipment and the needle they are using, if it is opened when you are there. Right. So those are the small things that you're supposed to, because they are quacks. If someone sees me on TV doing it, they will go wherever they buy the machine, they come, but because they don't want to take it up to use one needle for each client, they use one needle for 3 clients. They're being cheap. They are being cheap. And then at the end of the day, you can get something else. Even AIDS, you'll get it. So, I mean, we have to be very careful where you're going and whoever is doing, and if they're qualified and they're certified to do the skin tag removal. I think if COVID has taught us anything, is to be hyper vigilant when it comes to hygiene and some of these places that we go to take care of our skin. Yeah. So are there any like additional problems that can be created from skin tags? Like if I have skin tags, is that going to cause something else, within my health regimen? Yeah, I would say if you have a skin tag and you've gone to be removed and whoever removed, they are very aggressive, or they do not take you through the healing process, how to take care of it, and they have not told you to come back. The clients who have, or any person who have the possibility of getting keloids, if you remove the skin tag wrongly, the wrong way, you can irritate the skin such that you will now start getting, the area you've removed, you start getting keloids. So do keloids look similar to skin tags? They're almost similar, but keloids, they are really dark and they look like a big scar, and they're protruding. But let's say you're prone to get keloids, and you went this place to remove skin tag, they are not well done, or the procedure was too aggressive to the skin. Then that skin, after you heal, you remove your skin tags, then in another few months, now you start getting keloids. Yeah. And that is another contraindication that you also check before we do a consultation. We'll ask, does your skin get keloids? If you're more prone to keloids, then we'll send you to a doctor, or we'll be more careful not to irritate the skin the moment you are doing it, knowing that this client can get a keloid after the skin tag removal. Yeah. Or the aftercare will be more cautious, and we'll also give you a skincare products to take care of the area. So then we prevent you not to get keloids after now sorting one problem. Yeah. So someone would get more keloids if not done well. What type of products is it, or what ingredients in the products for aftercare should people be making sure that are present when they're taking care of their skin? Okay, it has to be a petroleum jelly, which is more Vaseline. Yes. And chamomile. Chamomile is also for calming and soothing the skin. Yeah. So those are the most ingredients, but we have a specific cream called Ampa that we normally give to our clients after every skin tag removal, that they keep applying. And also when they go home, we tell them to first sanitize with the Savlon, which is less strong. Then they sanitize, or they clean the place before they apply the jelly. Yeah. And we keep calling our clients the following day, after 2 days, to keep up how they're doing. If
Very
it's more
important,
painful
yeah.
or it's not falling, they come back, we continue taking care of the
Yeah.
area that we've removed.
Yeah.
So there's that aftercare that we need to follow up.
Yeah.
Yeah.
Very helpful information, Domi. And I'm just going to ask you for a parting shot for people watching at home who might be suffering from this or know somebody who's suffering from skin tags.
Yes.
What's your final thoughts?
My final thoughts would be go to a dietitian, dermatologist, or a doctor, and make sure when they say they can remove skin tags, then what's the procedure? How are they certified to do it? And the cleanness of the area, are they using the one needle for me as a client? Are they sterilized? Are they using gloves? Is it clean? The place that they are working from? And have they done a consultation? If they haven't done a consultation, then there could be contraindication that you will remove your skin tag, then you get more worse getting keloids or getting a viral infection. So we need to be very careful on where we are going and who is doing it. Get to know if they are well informed on what they are doing. Then if not, probably just make sure you go to an expert. But again, don't remove it from home.
Yeah.
Go somewhere where it can be taken care of.
Got it.
Thank you very much.
Thank you so much, Domiana, for
Thank you,
welcoming
and
us.
thank you for
You're
having
always
me.
A joy.
Thank
You're
you.
always a joy to talk
Asante.
to, and you've
Thank
educated
you.
us very much today.
Yeah.
Remember, if you have any questions or comments about what you've seen here today, we can get that answered for you in upcoming shows. If you just follow us on social media, we're on Twitter, Facebook, and Instagram, Skin Therapy Show. Look for us. If you want to contact me directly, I'm on Instagram and Twitter at Joey_Muthengi. Thank you so much for making time for us today, and I hope that you've learned something new. Until next time, bye-bye.